Right now, we are joined, I'm very excited about this, by BCBA, Board Certified Behavior Analyst Angela Persicke, and I've asked her specifically to come in and talk with us about some other research. A lot of you have been writing in, now that you've got insurance funding to some degree, are writing in and saying, okay, my case supervisor or my BCBA or the insurance company or somebody has said, here are the number of hours that are appropriate for my child. And how do I know that this is the right number? And a lot of times we're hearing numbers that are 10, 15, 20, 25, and parents saying, how can this be? We've heard you talk on the show about 30 to 40 hours. So we wanted to talk about some research and put some information and some power in your hands to be able to go back and further the conversation. So Angela, thank you for coming in and talking with us about that. Mm-hmm. And what do we need to know? Hook us up.
Okay, well, first of all, the 30 to 40 hours, that's what we consider high intensity. Okay. And all of the studies that have looked at intensity of ABA have looked at some high versus low, and low would be like under 20 hours.
Okay.
High, you usually consider above 25 hours, high intensity. And so overwhelmingly, the evidence has shown that the higher the intensity, the better the outcomes of the children. Okay. So it's not necessarily that there's this special number, you know, that it's exactly 30, it's exactly 40. But the studies that have been conducted have shown that the children just overall, the relationship between the number of hours and how well the children do, the higher the hours, the better the children do.
Right, but we don't want to make it sound like, oh, you know, we can pick a crazy number like 80 hours a week, but the cap on it seems to be 40. That's a reasonable amount, and they're still successful at great progress at 40.
Exactly.
The kids do get tired. We're not talking about 60.
No.
We're talking about that 30 to 40. Okay, so talk about some of the specific studies that if I'm a parent and somebody is saying with my 3-year-old child, well, we think that 20 hours is appropriate, what are some studies that I can point to and quote and say, well, here's a study that shows that 30 to 40 is effective. Where's your study?
Okay, so Reed and colleagues, REED, 2007, they specifically looked at, they used a descriptive analysis to look at low versus high, and they looked at under 20, so you know, 10 or less to 20 hours, and then over 20. Okay. And so that's like 20 to 40 hours. Okay. And they show that the higher intensity, of course, the children performed better. Okay. But in outcome studies in general, you see the better outcomes with 30 to 40 hours. Okay. And if you go to autismresearchgroup.org and our resources page, there is a document on there that lists all the outcome studies and lists all the studies on intensity. Okay. And I understand we have a graphic too that we can put up and talk just a little bit about here. So tell us what this is. Okay, so this is a graph showing the mean weekly hours that were from these different studies, these different publications over time of professionally directed early intensive behavioral therapy. So on the bottom, you can see the mean weekly hours, and then on the side, on the y-axis, you can see the change scores. And the dark circles, the filled-in circles, are change in IQ scores, and that's the top set of data points with the line. And let's just talk about those for a second. Okay. For outcome, we like to look at the change in IQ from start to finish. Okay. So how many IQ points did the child improve on? So if you look at that graph, you can see the children that were receiving fewer hours of therapy, under 25 hours, their IQ scores did not change as much. Okay, Emily, can you show us the graph again? Because I want to go back and look at that. So the black dot is the child who had 10 hours. This as a group. So each dot refers to a specific outcome study. So a group of kids who got 10 hours, they essentially did not have a change, or their IQ went down. Exactly. You can see, and that first dot right there at 10 hours a week, the black dot that you can see on the bottom, those children, their IQ as a group decreased. And this was from the Lovaas study.
Okay.
This was from the original Lovaas study. So the low intensity group, 10 hours a week, their IQ actually decreased.
Okay.
From start to finish.
And keep in mind, folks, that your insurance company is paying for ABA therapy because it's been proven to be effective. And they're going to be looking to see that your child is meeting goals because they want your child to be done with ABA at some point. They don't want to pay for it for the rest of their lives, so it needs to be effective, which means we need to get the progress that we need in as quick amount of time as possible.
Exactly.
So they're going to be arguing with the ABA provider about, are you being effective? Well, how can you be effective if you're giving the wrong prescription? Emily, can we look at the graphic again?
Okay, so if you bring up the graph again,
there we are.
And you can see that there's the diagonal line on the top is increasing. That shows the relationship between number of hours and better outcomes. And you can see it once you get above 25 hours, actually more like 30 hours, those are when you see the best outcomes.
Right.
So change scores above 10 IQ points.
An amazing difference. So very visual there. Now talk to me about the ones that aren't filled in.
Okay, the ones that aren't filled in, this is the Vinland Adaptive Behavior Composite.
Okay.
So this is adaptive skills, communication, daily living skills, social skills, motor skills. These were assessed in a fewer number of studies. That's why there are fewer open dots on this graph.
Okay.
But you can see too that there is a relationship when you get to above 30 hours, even actually closer to 35 hours, that's when you see the most amount of change in adaptive skills.
Okay, so very clear why we're talking about that 30 to 40, that's the period where you're going to get the most IQ change, which is going to be lifelong beneficial, and then those adaptive skills. I mean, we're talking about the toilet training and the being able to move through your life and whether or not you need support.
Exactly.
So I know that none of us likes to talk about the fact that this comes down to money, but it does.
It does.
And so when a provider is saying, that you qualify for 20 hours, that's significantly less expensive than 35 hours a week because it's ongoing and we know it's going to be for more than a year. It's going to be 2 to 4 to 5 years of this amount of therapy. But when we average how much it could cost for support for a child to have all those adaptive skills help them over a life, it is staggering the cost. So worthwhile for the insurance company to do this and do this right.
Yep.
Okay, so you're in a position of, you need to argue this with the person, and I want to make everybody know too that when somebody comes back with that first number, that isn't the be all end all.
No.
There is a discussion that can happen. So again, I always feel like I want to go in armed with things. So tell us again, we go to the website.
Go to autismresearchgroup.org, and on there under the resources tab, you will find documents. And there's a document for outcomes of early intensive behavior therapy for children with autism. That is the document name. And you click on that, and there's a couple pages listed with the outcome studies. And there's actually one that's a couple studies under the heading intensity. So those are the ones that you specifically want to take. So the intensity of treatment.
Right.
And those ones are listed on there. There's the Lovaas study. There's the Reed et al. That I just talked about. Also Grand Pichet et al. That we did here, showing across almost 300 children that the greater the intensity, again, greater number of mastered operants or mastered skills over time. So
it's showing that it's working.
Yep.
The child's learning and growing. So super duper important. And I'm not a lawyer, nor am I an insurance expert, but we all understand that the reason why insurance is paying for it is because it's supposed to be effective. And I do know that sometimes when you go in and you say to somebody, you sit with a confidence and say, thank you so much, we got your recommendation of this many hours. We have some questions about it. Why do you feel that that's what's effective? Use those words. Tell us why that's the number that you have arrived at. Do you have any studies that you can show us that show that that's going to be effective with my child? I happen to have these 4 studies that show that what's appropriate and effective is 30 to 40 hours. I'm wondering what you have that you can show me is effective at 22 hours. And then listen to the crickets chirp, and stand there and be confident. Don't be obnoxious, right? That's very hard for me to not be obnoxious when I know I'm right. But try not to be obnoxious. Try to be really, really nice about things. But I tell you that a lot of times people see the confidence and see, okay, this is going to be the pain in the butt parent. I love being the pain in the butt parent, because guess what happens? They will give the pain in the butt parent the thing that they know that they were supposed to give everyone to shut the pain in the butt parent up. And that translates to our kids.
Exactly. And a lot of times they will recommend fewer hours because the kid is in school, and it's, if the child is going to school 15 hours a week, 20 hours a week, and then has an additional 20 to 25 hours of behavioral therapy on top of that, if the child is in a good school, an ABA based or an autism program, and is receiving a lot of one-on-one in their school, then that's fine. If they're only able to give 25 hours on top of the 15 school hours,
right?
And we don't want our child to be exhausted and have so much going on. We usually say about 40 hours a week total.
Okay. But if a child is not in school yet, but they're engaged in other things, like maybe there's a play group that they're engaged in that's not ABA, should those hours be counted towards, so that if the provider is saying, okay, well, we're talking about 30 hours for this child, and they go to this play group and they're there for 5 hours a week, so therefore we're going to say 25. That's certainly something we can ask some questions about, right?
Yes, ask some questions about that. Again, the research shows that intensive one-to-one behavior therapy, 30 to 40 hours of one-to-one behavior therapy.
Great thing. So you can go and say, can you show me where on any study that giving 20 hours of ABA and 5 hours of this play group was effective? And keep using that language, excuse me, because that's where you're hitting them where they live.
And there are other outcome studies who have specifically looked at eclectic treatments. So a mixture, not just the one-to-one ABA, but a mixture of treatments, and those are not as effective, even with the same number of hours a week.
Is that included on that stuff that's on ARG? Okay, because that's a really important point too. And I can tell you that I once sat in a room, what I was arguing was that ABA was effective, right? I wasn't arguing how many hours, but I was sitting there and they were saying, no, we want your child to go to this very eclectic school program. And I said, well, here are my studies, where are yours? And suddenly my child had an ABA program in his home. You don't have to be obnoxious about it, but
be prepared.
Be prepared, and you're on the right side of it. Know that. Have that confidence in the way you hold yourself. They recognize it. They know, okay, I'm not going to mess with this parent. Because there are lawsuits that will happen if they, you have legal recourse. Absolutely wonderful. Anything else that you want to tell us?
No, I think that's it. But they can feel free to email us, info@autismresearchgroup.org, or contact you, and you'll get it to us, and ask us any questions.
And if there's a specific study that they want to get hooked up to, sometimes that's overwhelming for a parent about finding how, like, you can get just that, I don't even know what that opening paragraph of the abstract is, but you can't get the rest of it. You guys are really helpful at being able to hook people up so that they understand where to go to. Sometimes you can even ask somebody who wrote the study and they'll be happy to send it to you. So if you have questions about that, they can talk to you as well. Okay, great. Thank you so much, Angela. We so appreciate this information. It really is life-changing for a lot of people.
It is.
So thank you so much.